Welcome to today's presentation, customised for the Charities Regulator. My name is Rob Rowe from the Safety Squad. I'm an occupational health and safety consultant and experienced tutor. Feel free to contact me with any questions you may have. In this session, employees will learn how to defend against the spread of COVID-19. Please refer to the latest public health advice issued by the HSE and gov.ie. Coronavirus COVID-19 is spread in sneeze or cough droplets. You could get the virus if you come into contact with someone who has the virus and is coughing or sneezing, by touching surfaces that someone who has the virus has coughed or sneezed on, and bringing your unwashed hand to your face, eyes, nose or mouth. Employees are advised to follow public health advice and guidance. You should seek professional healthcare advice if unwell. The Charities Regulator has arranged the necessary controls identified in a risk assessment to prevent the spread of COVID-19 in the workplace. Please make yourself aware of its contents. Employees are advised to follow public health information and guidance, including ensuring good hygiene practices, such as frequent hand washing, respiratory etiquette and physical distance to protect yourself and your co-workers against infection. Please complete your company pre-return to work form and forward it to your employer. This form should seek confirmation that you, to the best of your knowledge, have no signs and symptoms of COVID-19 and also confirm that you are not self-isolating or awaiting the results of a COVID-19 test. Employee hygiene practices are important to prevent the spread of COVID-19. We have put in place appropriate signage around the building to communicate the HSE recommendations to prevent infection spread. We have used the COVID-19 Return to Work Safely protocol as a guide to adapt our workplace procedures and practices to comply fully with the COVID-19 related public health protection measures identified by the HSE. Employers and employees both must work together to protect everyone in the Charities Regulator. Further information and checklists can be found at hsa.ie. We have a robust communication strategy in place to prevent misinformation and have appointed a lead worker representative to coordinate new COVID-19 safe systems of work. We aim to provide up-to-date, reliable information to employees, suppliers and customers. We clarify our company's procedures and policies, and we ensure visibility regarding the COVID-19 resourcing and implementing of the safety measures identified in the Return to Work Safely protocol. The following are some of the control measures that we've implemented at the Charities Regulator. We've developed our COVID-19 response plan. We've updated risk assessments and safety statement. We've included a response plan to deal with a suspected case of COVID-19, and we'll keep a log of staff and visitor contacts to facilitate contact tracing. Cleaning routines and hygiene controls are everybody's responsibility. Practice good respiratory hygiene. Here are some steps that we've taken to help protect staff, and we hope that you will help us implement these in a positive way. Where possible, non-operational staff are encouraged to work remotely, and this must be arranged with your manager beforehand. Breaks. In order to reduce demand for the kitchen facilities, we recommend staggering the breaks and limit the amount of people at any one time. Toilets. Adopt a common sense approach, one person a toilet at a time, and respect social distancing. Some other behavioural rules that we have in place and we hope that you will follow. Please use common sense and courtesy towards others. Try to maintain 2-metre social distancing between people. Stand back and let people pass if you meet each other in the corridor. And face coverings are optional. Good hand hygiene is always encouraged. There will be 6 wall-mounted sanitizers around the office. Clean your desk before and after use. Wipes and sprays will be available from corporate affairs, and wipe down computers, printers, photocopiers and communal work equipment after use. In the COVID-19 risk assessment, we've highlighted zones. Zone 1 is for corporate affairs and finance. Zone 2 is for registration and compliance. Zone 3 is for the charity services, and then Zone 4 is the meeting rooms, Shannon and Liffey. Please respect others, move along main walkways and limit your movement between these zones as required. Office cleaning. The frequency and depth of the office cleaning has been increased with our external cleaning contractor. Everybody has the part to play in cleaning our workplace and the individual workspaces too. Unwell at work. The leave room has to be used if somebody becomes unwell at work with COVID-19 symptoms. PPE, personal protective equipment, will be provided outside the leave room. Masks and gloves should be worn by all involved. And the person's GP should be called and their advice followed. Contact with a confirmed case of COVID-19. A designated isolated area should be predetermined as part of a response plan. The Charities Regulator has highlighted the leave room for this purpose. The designated area and the route to the designated area should be easily accessible for people with disabilities and anyone on site. The leave room was chosen because it meets this criteria and easily accessible. The designated area should have the ability to isolate the person behind a closed door and suitable to facilitate the following. The leave room has good ventilation as there is a window that can be opened. There is also hygiene material provided. There's tissues, hand sanitizers, cleaning disinfectant, personal protective equipment, gloves, masks, and then clinical waste bags and bin should anybody come in contact with a confirmed case of COVID-19. If somebody becomes unwell in the workplace with symptoms such as cough, fever, difficulty breathing, or is a suspected case of COVID-19, the response team should isolate the employee by accompanying the individual to a designated isolated area via an isolated route. For this purposes, the Charities Regulator has highlighted the leave room, and access should be along the main corridors or using the emergency escape route to facilitate this room being used. Maintain a distance of at least 2 meters from the symptomatic person at all time. Staff are encouraged to wear personal protective equipment as required. The unwell individual should be provided with a mask to be worn in the room with other people or while exiting the premises. The COVID-19 response team should initially assess whether the unwell individual can immediately be directed to call their doctor or continue self-isolating at home. Where that is not possible, the unwell individual should remain in the isolated area and the response team should risk assess the situation further. For contact logging, please follow HSE guidance on this matter for suspected and confirmed cases of COVID-19. Cleaning of all general work areas and frequently touched objects and surfaces should be conducted at irregular intervals. Disinfectant is required in bathrooms, toilets, and when a suspected case of COVID-19 has been in the area. We've gone to great lengths to source disinfectant and cleaning products that are suitable for the offices of the Charities Regulator. Please read labels, follow safety data sheets and the guidance, and wear appropriate PPE as required. The current recommendations for the use of personal protective equipment or PPE for possible or confirmed cases of COVID-19 in a pandemic setting, please visit hpsc.ie. There's loads of helpful posters and guidance about gloves, masks, aprons, and all other manners of personal protective equipment. Traditionally, a hierarchy of control has been used. The hierarchy ranks control measures according to their reliability and effectiveness. At the top of the hierarchy, we have engineering controls, followed by administrative controls, and ends with PPE. Personal protective equipment is always the last line of defense. In the context of risk of respiratory infection, PPE adds an extra layer of protection to hand hygiene, respiratory hygiene, and cough etiquette and environmental hygiene. Again, please visit hpsc.ie for more information of the correct use of PPE. So that about wraps up today's presentation. We look forward to hearing your feedback and any comments you may have. Please make yourself aware of site-specific COVID-19 signage, protocol, and risk assessments. A strong communication and a shared collaborative approach between employers and employees is the key to protecting against the spread of COVID-19 in this workplace. It is also essential to achieve success and maximum buy-in from everybody. We will have regular engagement about COVID-19 and thank you for your support in making this workplace safe.